Welcome to another episode of Faisel Friends. We're here because we believe everyone deserves access to quality primary care, and ChenMed needs physicians to take care of them. Today's topic is rebuilding primary care. My co-host and moderator of the chat, Dr. Dan McCarter. Dr. Dan.
Hey, Faisel. It's good to be with you again this evening.
Good evening. So good to see you, Dr. Dan. I'm very excited about tonight's episode and the friend joining us. We had this guest on before the podcast when we were going live on social media alone. I'm excited to welcome our friend, Dr. Dave Chase. Not doctor, I'm sorry. Dave Chase. I'm sorry. Welcome, Dave, to the evening.
No, don't sell yourself short. You went through a lot of education I didn't have to go through.
Oh, thank you so much for joining us this evening, Dave. And I am such a huge fan of yours. I remember listening to your TED Talk even prior to joining ChenMed, and so I'd like to start off this evening by asking you about your life, and if we could start from Microsoft and how your life has gotten to where you are today.
Yeah, I mean, I founded Microsoft's healthcare business. A lot of people don't realize Microsoft's got a $3 billion business in healthcare. Think of Microsoft as making Legos. Other people assemble those into solutions. They've got 28,000 partners globally. I've been out of that a long time. There was a lot of people who contributed tremendous amounts, after I left. So I don't take credit for all that by any stretch of the imagination. But candidly, that was a time when I just looked at, healthcare is a great industry, people industry, but it didn't hit me in the same way that it does now. And unfortunately, by the time I was 40, I'd had 10 friends my age or younger die. And all those are gut punches, difficult situations across the board. But the last one really hit me hard. There's a friend who'd had a similar career trajectory to me, done the right thing, done pretty well. But ultimately, it was a complete system failure. She got misdiagnosed with cancer, and which led to the wrong treatment plan, ultimately devastated her financially, psychologically, medically, ultimately leaving behind a 10-year-old daughter as a single mom. And that was a real gut punch, because as I looked at that situation, as I said, it was a complete system failure. I'd been a part of that system. The way I was raised, you see a wrong and you don't do something about it, you're complicit. And so that really put me on a real journey that we can talk about more in some other pivotal moments. But that really got me understanding that, sadly, there's, in my view, as I've studied this deeply, there's no greater immediate threat to our country than our status quo healthcare system. That's how bad it is. I mean, the first chapter of my first book is we've gone to war for less than what our status quo healthcare system has done to America. And I make a fact-based argument that I would, go to the mat on.
Wow. Could you imagine if the country viewed, we don't, if God forbid, when you go to war, we don't think about the cost of each missile that's being fired. You just do what you got to do when you go to war. And so far as national defense is concerned, I know most of us don't think about the cost of protecting the country from an attack from another country. But so far as our own health is concerned, we don't have that as a society. We don't have that concern about prevention, early and efficient intervention. We don't have that.
Yeah, our real mission in what we do with this nonprofit and public benefit corp that we have set up to tackle this, and I write about in my books, is our mission is to empower community-owned health plans. And there's plenty to unpack there, but one way of understanding it is flipping those words on their head. And that is what we have. We have disempowering Wall Street rented sick care plans. That is what's created this mess. And there's good people inside of organizations that want to do well, but the perverse incentives are creating a real damage to our society at all levels, including the caregivers, right? I mean, they live it every day. In some ways, they're the biggest victims, and this was even pre-COVID. And now, we had record levels of burnout and even suicide amongst nurses and doctors, and it's gotten worse during COVID. And I tend to think of COVID as a super spreader event against a set of societal pre-existing conditions. They were there before, they just shined a big light on
it. You said that our greatest threat to America and to our economy is our healthcare system. What would you say are some of the pivotal moments over the last, say, 20 some years that helped drive us in that direction?
Well, you talk plenty about fee for service, right? And then fee for service in primary care. That has led to a systematic destruction of our primary care infrastructure. And we know there's no well-functioning healthcare system in the world not built on proper primary care. Mm. And that has massive ripple effects across the board. How we dealt with COVID, the book I wrote that looked at the healthcare system through the prism of the opioid crisis. This is a bit of oversimplification, but basically a destroyed primary care laid the foundation for the opioid crisis. We were totally vulnerable to some bad actors, right, in terms of what they did. And on the flip side, I like to focus on the positive. If you look at the models that we are promulgating, they didn't develop some anti-opioid crisis problem before the opioid crisis existed. They just did primary care right. When you do primary care right, guess what? You don't have the opioid problem. You don't have the rising benzos issue that's not even getting the attention it should, and it's gotten even worse during COVID. I mean, I haven't seen recent data, but a few months into COVID, benzos prescriptions, which were already world-leading levels, went up 34%. And it's overshadowed by COVID, understandably. It's certainly overshadowed by the opioid crisis. And really the thesis of the opioid crisis wake-up call book was the crisis isn't an anomaly. It is our healthcare system.
Dave, we have a comment from Hector, and I think it fits right in here. He says that 17.5, and I'm sure he's saying 17.5% of our GDP is being spent on healthcare. They don't want us healthy. And that's really, I wonder, do you think it is people really want us sick, or are they're having to function in a system where they only get paid if people stay sick? So they're doing the best to help people get healthy, but the system is just designed wrong for that.
Yeah, I mean, you'd have to be a really evil person to want the outcomes that we have. I think most people that are in it, kind of from the business side, just treat healthcare as an abstraction, that it's some industry, and we have some objectives, and we're just following those objectives, and they just kind of have the blinders on. They're not thinking about the collateral damage. We know that at least $1 trillion is wasted every year. That's probably quite conservative. PwC, National Academy of Medicine, well documented. That would be just trillion, and it's probably more. That would be the 15th largest economy in the world. And I think of that as a tax that none of us voted on, that's levied by Wall Street, and they have people carrying their water, but they're doing it rationally. They're doing it given a rational set of objectives. They're doing rational acts. It's just, and we'll just go back to the opioid thing. If you look at opioids, what's the number one driver of opioid prescriptions? Lower back pain. 80% of adults will have an acute episode. We absolutely botch it.